I migrated with my parents in 1996. We were here about 3 months and had a car accident. I was with my cousins on the freeway. Somebody hit us and I was a broken nose, but still needed to be followed up at a clinic. So they recommended to come to Camino Health Center since none of us had insurance.
The number grows daily of people who no longer have health insurance or who have never had health insurance. And that's the niche that Camino Health Center exists to serve. It somewhat sounds cold to say that we see the patients nobody else wants to see. Many of our patients have to decide whether they're going to have money for the medical visit or groceries. So it's incumbent upon us to provide them with the best service we can, and also to be understanding of their circumstances.
We do help a lot of people who just don't have the resources or the opportunities. And it could be any of us. Every day we are getting new patients, and I see more and more of myself in the patients. Maybe their kids go to my kids' school, and I see that it can happen to me. I mean, it doesn't take much for a loss of a job, and then you lost your health insurance, and then what would I do? Well, I know that I can come here and get the help that I need.
The questions are simple, what's wrong with you, how can we help? And regardless of whether you can afford it or not, they still are there to help you. They have volunteers that would see you for the same minimal amount of money that you could have spent thousands. And if they were not here, I don't know, maybe one of us wouldn't have made it because we wouldn't have had the access.
Camino is crucial to the community where there may not be a lot of resources available for health, dental, and nutrition care. And Camino has been a lifeline to these folks that really may not have another place to turn. And so we're able to provide quality health care for these folks that might forgo their health care and then have harder times in the future.
One of the things that I am so happy about working here is that I get to do preventive medicine. I get to help people lose weight, learn about exercise, learn about diet. Those are things that help keep people out of the emergency rooms.
I just felt lucky to be able to receive the services, in a time of need, and I was just happy that there are people with such skills that are willing to, instead of going and making the money, to help people.
Virtually every member of our professional staff could be employed elsewhere for a more lucrative living. So there is a passion. Every one of the providers that works at a place like Camino similarly feels that what they want to do is take care of those that need to be taken care of that no one else would want to. I made a contract with society that says, if you will afford me the opportunity to undergo medical training, upon graduation from medical training, I will be a doctor that does something different, that serves a different population that needs to be served.
When I saw what Camino did, how medicine helps people, and I thought, well, maybe a career in medicine would be great, and if I can be one of those providers that it's a role model, somebody that can see, she came from nothing and grew into something else because somebody was there to show her the way, because somebody gave her the example of how to care for somebody. Then I would make a difference in one person, and I might not change the world, but if I can change somebody's world once a day, then it's good. The mobile unit, for me, it was my dream job. I wanted to come back here. I prayed many times to have an opening so that I could take that job. I love what I do. Here, every provider really teaches you how to care for the patients. They actually get involved with their lives. They help them, and they motivate people to go back to school and have a better life. And so they changed my life because they gave me that attention, so I wanted to give it back, and now I'm able to. So it's wonderful. It's good to be here.
It's so important that we get as much support as we can from the community.
When I see a group of individuals who are amongst the most fortunate in Southern Orange County actually take the time to remember my patients, it means that yes, there are people in Southern Orange County who don't look through you, who don't look beyond you. They actually look at you and they make an effort to help you.
Thank you, Camino.
Gracias, Camino.
Thank you.
Thank you.
Thank you.
Thank you.
Thank you, Camino, for being there for me.